Hi, very good morning. I am Dr. Janak Patel, MD, General Physician. All my video lectures are mainly for educative purpose. This is a short video regarding whenever you see a person in whom you are suspecting a stroke, how fast you can examine a person and confirm that person has developed stroke. So it is when the stroke strikes, there are some short mnemonics we call act fast or be fast or think faster. So these are the three, and we'll be talking about that. So whenever a person comes with a stroke, we do examine this. So fast, be fast, faster becomes a rapid examination in a person with a stroke. So whenever a person comes with a stroke, some neurological deficit which you are suspecting either because of thrombosis, embolism or hemorrhage, we usually use a commonest thing which was used before was act fast, meaning you examine a person's face. So if there is a facial nerve palsy, whether it is upper motor neuron or lower motor neuron, if it is upper motor neuron, the lesion has to be above the midbrain. If it is a lower motor neuron, the lesion has to be in a pons. So if a person has got the drooping of the face on one side of the hemiplegia, with preservation of frontalis belli and orbicularis oculi, it becomes a upper motor neuron palsy. So F stands for face, A stands for arm. So if there is a weakness on the side of hemiplegia, that is on the side of the upper motor neuron facial, it is characteristic involvement of a pyramidal tract, and best way to examine this will be possible in a fully conscious person. You ask the person to raise both the arm, and if the arm is drifting down in one of the arm, that side is a weakness or we call neurological deficit. And because of involvement of the facial muscle, that is upper motor neuron facial, as well as there is good number of time involvement of the upper motor neuron 12th cranial nerve palsy, that is genioglossus. This will produce a speech disturbances, that is S for speech. And if that is there, it is usually the lesion has to be above midbrain, that is in the pyramidal tract, opposite side of hemiplegia. But if there is a damage to the cortex, then person will have a dysarthria, aphasia. So if there is aphasia, it will suggest that the person has got damage in the dominant hemisphere cerebral cortex, and it will be mainly because of the MCA territory. And T stands for the time, because whenever you get face involvement, arm involvement and speech involvement, it suggests that the person has developed stroke, and time is very critical. In USA, call 911. In India, we call 108. So emergency, it is considered as an acute emergency. So you should contact a proper hospital and proper specialist, neurophysician, because every minute counts. So this is for act fast. There is another which is called be fast, where F remains same for face examination, A remains for arm examination, S remains for speech, and T remains for time. But BE, there is an additional two words which are being added. B is for balance. So if there is a one side hemiplegia or hemiparesis, person will usually not be able to stand erect. As well as if the person has got cerebellar damage or a brainstem damage, where if there is a damage to cerebellar tracts or cerebellum, that is particularly vertebrobasilar artery territory, person will have an imbalance and Romberg test will be positive. So B stands for balance. So if a person has developed an imbalance, that is also one of the sign of stroke, and mainly that will be because of the brainstem damage, which is supplied by vertebrobasilar artery territory. So we usually use the word VB territory, and there are two areas where if there is a damage, either in the cerebellum or vestibular nucleus, and that will produce balance disturbances. And E stands for eye symptoms, that is visual disturbances, maybe in the form of a homonymous hemianopia or visual disturbances in the form of a field loss or even total blindness. So if a person has got balance disturbances, visual disturbances, unilateral upper motor neuron facial, and on the same side arm involved, upper limb as well as lower limb involved, and there is a speech disturbances, this is described as Befast. So this is another term which is being utilized, and this is a rapid examination in case of a stroke. So B is for balance, sudden loss of balance. E for eye disturbances, particularly homonymous hemianopia or any visual disturbances, along with balance, face involvement, that is upper motor neuron or lower motor neuron facial, upper limb or lower limb involved on the same side, but at the same time you can have a crossed hemiplegia if there is a damage in the midbrain pons or medulla. You can have a unilateral lower motor neuron cranial nerve palsy and opposite side hemiplegia, and you can also have what is called as cruciate hemiplegia, where upper arm can be involved on one side and lower limb can be involved on opposite side if there is a damage in medulla, where crossing of pyramidal tract takes place, particularly the cross fibers, and that is called cruciate hemiplegia. And speech disturbances can be because of two conditions, because of involvement of the facial muscles and genioglossus of 12th cranial nerve, or person can develop aphasia due to involvement of the cerebral cortex, that is dominant hemisphere, due to MCA territory. And T, as previously, this was for time. Now here along with time, it is being added terrible headache, T for terrible headache. So if a person complains of a terrible thunderclap headache followed by a neurological deficit, this is also one of the findings which is in favor of stroke. So rapid stroke assessment will include fast, Befast, and there is one more mnemonics, that is we have already mentioned balance, eye, face, arm, speech, and time. And then comes what we call as a faster. F for face, A for arm, S for stability, that is balance, T for talking, that is slurred speech or even aphasia, E for eye, that is double vision or maybe even a field of vision being affected, and R for react fast, and that is call emergency, contact hospital, contact senior doctor, consultant doctor, etc. So that is called faster. So there are three words which are being utilized: fast, Befast, and faster. So any one of these, whatever you utilize, that will help you rapid examination in a person with a stroke. This will be difficult in an unconscious person. So this will be possible only in a conscious person. That is face, arm, balance, speech, eye, and R for react. And Befast, balance, eye, face, arm, speech, and time. And also T was considered for terrible headache, or we call thunderclap headache. And fast is only face, arm, speech, and time. So whichever method you go, this will be helpful. So you can remember this word, and this will help you to rapid examination in a person who has developed a stroke. So I end my lecture here. This will be helpful to you in your clinical examination as well as in your everyday practice. If you like this particular video lecture, please don't forget to press button like, press bell icon, subscribe, and you can share with your friends also. So thank you very much for taking out time. I know your time is very valuable, and I appreciate that you have spent some of the time with me. See you in next lecture. I feel this will be definitely helpful to you. This is rapid examination in a person with a stroke, and particularly if the person is fully conscious, then it will be very beneficial. But in an unconscious person, it will be extremely difficult. The examination will change totally. But in that also, face will be helpful. That is facial palsy, upper limb, lower limb involved, we call arm involvement, and speech will be only possible if person is conscious. But arm involvement and face involvement you can examine also in an unconscious person. So this will be what we call as a rapid examination in a fully conscious patient with a stroke. See you in next lecture.